What if I told you that losing a tooth might soon be as temporary as losing a baby tooth when you were 6 years old? Two countries are racing to make this a reality, and they are taking completely different approaches. Japan says, one injection and your tooth grows back. Korea says, stick on a patch and regenerate naturally. But which one actually works? And more importantly, which one will you be able to use first? Let's break down the biggest dental revolution of our lifetime. First, up Japan's approach. And this one has been making headlines worldwide. Scientists at Kyoto University Hospital, led by Dr. Katsu Takahashi, have spent over 20 years developing something extraordinary, a drug called TRGO35. Here is how it works. Inside your jaw, you actually have dormant third tooth buds, basically backup teeth that never developed. We have all got them, but they just sit there doing nothing. The Japanese drug targets something called the USAG1 protein. Think of USAG1 as the off switch for tooth growth. The injection contains antibodies that block this protein, essentially flipping the switch back on. And here is what makes this exciting. Human trials started in September 2024. Successfully regrew teeth in ferrets with no side effects. Expected to hit the market by 2031 injection per missing tooth, the ferret trials were particularly impressive. Ferrets with missing teeth grew back fully functional teeth within months. No complications, no rejections, just new teeth. But here is the catch. This is still in phase 1 human trials. That means they are primarily testing safety right now, not effectiveness in humans. We will not know the full results for several more years. Now, let's talk about Korea's approach, because it is radically different. Korean scientists have developed a tooth regeneration patch. Yes, you heard that right. A patch. How the patch works. Instead of injecting antibodies, this patch uses a combination of growth factors and stem cell technology. You apply it to the gum area, where the tooth is missing. And it works to stimulate your body's own regenerative capabilities. Here is what makes the Korean method unique. Non-invasive, no injections. Uses biocompatible materials, gradually releases growth factors over time. Aims to regenerate both tooth and supporting bone structure. The Korean research focuses heavily on what is called the periodontal ligament. That S, the tissue that connects your tooth to your jawbone. Their theory is that if you can regenerate this entire system, not just the tooth, you get better, longer-lasting results. But there is a twist. The Korean patch technology is still in earlier research phases compared to Japan's injection. They are currently in preclinical trials, which means extensive animal testing is still ongoing. So Japan has a head start in the race to market. But does that automatically make it the winner? Let's break this down side by side, because each approach has serious pros and cons. Delivery method. Japan. Single injection into the jaw. Korea. Topical patch applied to gums. Winner. Korea. If you hate needles, but injections might be more precise. Timeline to market. Japan, expected 2030 already in human trials. Korea. Estimated 2032 to 2035, still in preclinical phase. Winner. Japan by a landslide. You might be regrowing teeth in just 5 years. Scope of regeneration. Japan focuses on tooth structure itself. Korea aims to regenerate tooth, bone, and supporting tissues. Winner. Korea. Potentially more complete regeneration. But that is also why it's taking longer. Scientific evidence. Japan, successful ferret trials. Phase 1 human trials underway. Korea, promising lab results. Animal trials ongoing. Winner. Japan, they are further along with proven results in living animals. But here is the million-dollar question everyone is asking. How much is this going to cost? Right now, a single dental implant can run you anywhere from $3,000 to $6,000 in the United States. And that is just for one tooth. Early predictions for Japan's tooth regrowth injection suggest it could cost between $2,000 to $4,000 per tooth initially. But here is the thing, unlike an implant, this is your real tooth. No metal, no artificial materials, just your actual tooth, the Korean patch. Still too early to estimate, but given its more complex delivery system and longer development time, it might actually be more expensive at first, and insurance. That is the wild card. Neither treatment is approved yet, so we have no idea if insurance companies will cover this. It might be considered cosmetic at first, even though missing teeth definitely affect your health. All right, Let's get real about when you will actually be able to walk into a dentist's office and say, "I would like to regrow my tooth, please." 2024 to 2026, Japan completes Phase 1 and Phase 2 trials. Korea advances animal studies. 2027 to 2029, Japan enters Phase 3 trials with larger patient groups. Korea potentially begins human trials. 2030, Japan's TRGO35 could receive regulatory approval in Japan first. Limited availability, 2031 to 2033. Potential FDA approval process for the U.S. market. Korea's patch enters late-stage trials, 2034 to 2035. Both technologies potentially available globally, with Korea's patch hitting the market. So if you're watching this in 2025, you're probably looking at 5 to 10 years before you can actually access these treatments. I know it feels like forever when you're dealing with missing teeth now. So which approach is better? Honestly, we will not know until both complete human trials. Japan's injection is faster, more targeted, and closer to reality. Korea's patch is potentially more comprehensive, but requires more patience. The good news, competition drives innovation. The fact that multiple countries are racing to solve this problem means we win in the end. In the meantime, take care of the teeth you have, because while this technology is incredible, prevention is still your best strategy. If you found this comparison helpful, smash that like button and subscribe for more updates on dental breakthroughs. Drop a comment below, Team Japan Injection or Team Korea Patch. And if you want to know about side effects, costs, or when these treatments might come to your country, I have got videos covering all of that. Thanks for watching, and I will see you in the next one.